In this video, we're going to discuss some key terms and concepts used in quality assurance. You will also learn the differences between quality assurance and quality improvement and explore the approaches to quality improvement. Finally, we shall cover performance assessment. Let's get started by defining some key terms. So, quality is the measure of how something compares to other similar items or standards. It reflects how good or bad the item is based on that comparison. The other term is quality of healthcare. So this refers to the extent to which health services for individuals and communities improve the chances of achieving desired health outcomes while adhering to current professional standards and knowledge. Another term that needs to be defined is quality assurance. This refers to all the processes within the healthcare system that contribute to establishing a culture of consistently doing the right things correctly every time. So quality assurance is anchored in the concept of being able to determine upfront, acceptable, and affordable levels of performance and institutionalizing mechanisms to be able to tell when these levels are being achieved or not. Another key term is quality improvement. So this involves utilizing effective methodologies and quality management tools to bridge the gap between current and desired levels of quality. So the process follows this approach. Identify. This is why you determine what areas need improvement. Analyze. This is why you gain a deep understanding of the problem. Develop hypothesis. This is where you identify the changes that will lead to improvement. PDSS cycle, which is the plan, do, study, act cycle. So this is a framework for testing and implementing the changes. So on the right side, we have this diagram, which is the PDSS cycle. Okay, so on the planning part, this is where you are asking questions like what areas are we improving? How are we improving? When are we improving? And how do we measure the effects? Okay. On the do phase or stage, this is where you inform people affected by change. You implement the change, measure, and then monitor that change. On the study phase or stage, this is where you analyze the data from the do stage. Okay, you ask questions like, was there any improvement and by how much? Were the objectives met? Then on the act stage, this is where you take action based on your analysis from the study stage. So another term is performance improvement. So first of all, let's define what performance is. So performance in the context of human performance technology, performance refers to the task and work that an individual undertakes, including the manner in which they execute these tasks and the outcomes they produce. It encompasses the performer, their efforts, and the results of their actions. So achieving performances often requires collaboration within a team, and it is essential that the environment in which the team operates is supportive and conducive to success. So what are the differences between quality assurance and quality improvement? Let's start with quality assurance. So quality assurance measures against certain necessary standards and is normally focused on individuals. It focuses on finding who is responsible for errors and relies on inspections to identify those errors. Okay, so on the right side, we have the quality assurance cycle. So step one, this is the planning phase. So after planning, we're going to move to step two, where standards are going to be set. After step two, we are going to communicate those set standards. Then we're going to move to step three, where we need to monitor those standards that we communicated. Step five, we're going to identify and prioritize opportunities for improvement. When step five is done, we're going to move to step six, where we're going to define the problem. After defining the problem, we're going to identify who is going to work on the problem, which is step 7. Then we're going to move on to step 8, where we're going to analyze and study the problem. After doing that, we're going to choose and design the solution, which is step 9. Step 10, we're going to implement the solution. Now, from step 10, there are 4 outcomes. It's either whatever solution that we implemented was not working, meaning we need to go back to step 1, where we need to start planning. Okay? The other option or the other outcome is going to step 2, where we're going to set the standards. Okay? Then step 3 also, where we can communicate those set standards, and the last outcome is step 4, where we're going to monitor those implemented solutions. Okay, so this is the quality assurance cycle. Okay, so on the other hand, quality improvement is a proactive and continuous approach to improve processes and systems. It is internally driven and empowers all personnel to make improvements. It seeks to prevent errors by continuously clarifying and improving processes. So if you look at the differences, you're going to find that under quality assurance, the quality assurance is only looking for the errors and who is responsible for those errors. But when it comes to quality improvement, it is seeking to prevent those errors by making sure that there is continuous clarification and improving of the process. Let's now discuss quality assessments and measures of performance. So when it comes to these quality assessments and measures of performance, there are principles involved. So the principles of quality assurance. The first one is that it is client focused. So quality assurance stresses the fact that health services exist to meet the health needs of the clients who use them. So by focusing on serving the needs of clients, healthcare providers perform better, and this means caring for the entire person rather than simply addressing the ailments. Another principle is understanding work as processes and systems. So quality assurance recognizes that unclear, redundant, or incomplete systems or processes may cause problems in the delivery of quality healthcare. Instead of blaming the people working in these systems for poor performance, quality assurance involves them in the prevention, detection, and solution of problems within our processes or systems in order to improve the quality of care. Testing changes and emphasizing the use of data. So quality assurance emphasizes the need to improve processes by understanding how they function. So this principle promotes decision making based on accurate and timely data rather than on assumption. Understanding and using data also means understanding variation or differences in the output of the process or whether it indicates a real change. So either as an indication of a problem or of an improvement. Another principle is teamwork. Quality assurance focuses on participation and teamwork to solve problems and implement quality solutions, recognizing that the impact of quality assurance activities is most powerful when team members draw on the participation, experience, and knowledge of major participants and stakeholders. So to understand quality assurance, you need to know quality assessment and the types of assessments that should be done. Let us look at that. So, how should you conduct quality assessment? Assessment can take the form of a snapshot assessment or a detailed study. So, how do you carry out a quality assessment? You need to start by finding out if you have all the things you require to provide quality services. Then you need to consult the beneficiaries on whether they are satisfied with the way services are being provided. For example, you ask the client about the health center. Then you need to take action to improve the problems that have been identified. Okay, let's now look at measuring quality. As a leader, you will need to know the measurements used in quality. There are three types of measures used in quality work. So there is a structure, process, and outcome. Structure, this is physical equipment and facilities. Process, that is how the systems work. And then the outcome, that is the final product or the results. So structure and processes are easier to measure, but the outcome is more important. There are various types of assessment which may be done in relation to quality assessment. These are self-assessment. This is a type of assessment which is done by oneself. Then there's the peer assessment, which is done by a colleague at the same level as you are. Then there's a quality survey, which is done using a questionnaire, which defines the quality. There is also the exit interview, where patients are asked as they leave the health facility about the care that they have been given. There is also equipment checklist of normal requirements, where you take an inventory, and also there is monitoring and evaluation. Now that we have gone through the types of assessments in quality assessment, it is important that we expand on monitoring and evaluation aspect. So monitoring is the systematic collection, analysis, and use of information from projects and programs for three basic purposes. The first purpose is to learn from the experiences acquired. So that is the learning function. Then to account internally and externally for the resources used and the results obtained. That is the monitoring function. And the last one is to take decisions from the learning and monitoring function. So monitoring is done through the following activities. 1. Use of indicators, supervision, reviewing of documents, having commitment and interest, knowing how to interpret data, knowing how to change the situation. Evaluation involves systematically and objectively assessing ongoing healthcare services or a completed project or program. The goal is to determine their relevance, effectiveness, efficiency, impact, and sustainability. This information helps to decide whether changes are needed at the project, program, or policy level. An evaluation identifies what has worked well in healthcare services and highlights areas for improvement. It serves two key functions: the learning function and the monitoring function. So under the learning function, lessons learned are incorporated into future proposals or policies. Under the monitoring function, partners and stakeholders review the implementation of policies based on objectives and resources mobilized. Monitoring and evaluation are complementary in service delivery. During an evaluation, information from previous monitoring is utilized as much as possible. While monitoring focuses on processes and results, evaluation provides insights into the relationships between results, effects, and impact. Therefore, monitoring and evaluation help managers steer and adjust current programs and projects, while also providing valuable lessons on what works and what doesn't. Let us now look at how performance is measured. So the following are the measures of performance. Quality: the performance matches the specification, meeting customer expectation. Quantity: rate, timeliness, cost, labor, material, and management. Let us now turn to quality improvement. Earlier we defined quality improvement as a continuous process of identifying areas of concern, which are the indicators, collecting data on these indicators on an ongoing basis, analyzing and evaluating the data, and implementing the needed changes. Okay, so this diagram here illustrates quality improvement as a formal approach to the analysis of performance and systematic efforts to improve it. So the common denominator, so to say, is everyone. Okay, so everyone is going to lead to better patient and population outcome. Okay, everyone is going to lead to better professionals. Everyone is going to lead to better system performance. And then it makes a cycle. If we have better professionals, it means we can have better patients and population outcome. And it also means that we can have better system performance. Okay, and if we have a better system performance, it means we can have better professionals and we can have better patient and population outcome. If we have a better patient and population outcome, it means we have a better system performance, and at the same time we have better professionals. So it requires everyone to be involved when it comes to quality improvement. The approach to healthcare improvement follows key principles of quality improvement, which includes focusing on the patient, involving teams of healthcare workers in testing changes to enhance care, and implementing changes to processes and systems in care delivery to drive improvement. There are essentially two main approaches to quality improvement. That is the performance improvement approach and the 5S approach to managing the work environment. Let us discuss these approaches one by one, beginning with performance improvement. So this is a systematic process that incorporates the following 9 essential elements. We have technical competence. In this technical competence, this is where it involves the knowledge and skills required to deliver high quality and safe healthcare. We also have technical performance. Even when a healthcare worker possesses the necessary knowledge and skills, they must apply these skills effectively and have the required resources to provide the correct service. We also have effectiveness. So the care provided must achieve the desired outcome. We also have efficiency, where there is providing timely services with minimal waste. We have safety, where both healthcare providers and clients must be protected from harm in the institution. There is accessibility, where clients have the right to healthcare, meaning all barriers to accessing it should be removed. There is continuation of care, where clients should receive coordinated care across services. We also have interpersonal relationships, which refers to fostering a peaceful and friendly work environment. Then we also have amenities, which refers to the resources that provide comfort to both staff and clients. Let's now discuss the factors influencing performance or performance factors. One of them is job expectations. So the guidelines, policies, procedures, and protocols, as well as how they are communicated and understood by the providers. We also have performance feedback. So this is the method by which providers are informed of their performance in relation to set standards. So feedback should be constructive and immediate to remain relevant and effective. The other factor is environment and tools. So the physical environment, including facilities, supplies, materials, and tools available to providers. We also have motivation and incentives. So the systems, strategies, and tactics used to stimulate and maintain the desired performance level. The other factor is organizational support. So this organizational support plays a crucial role in aligning the organization's mission and goals with desired performance outcomes. Clearly defined roles and responsibilities are essential for ensuring efficient task completion. A supportive supervision system is in place to guarantee that all performance factors are adequately addressed, providing necessary guidance and oversight. Additionally, the organization implements systems and interventions to continuously enhance overall performance, ensuring alignment with its strategic objectives. The last performance factor is skills and knowledge. So in this one, there is capacity building in individual team members. Let's now discuss the performance improvement framework. This approach to quality improvement involves a step-by-step method that identifies performance gaps, identifies the requirements for optimal performance, and implements targeted interventions to achieve it. The performance improvement approach involves a systematic process to determine what is needed to ensure good performance and how to deliver it. So the goal of performance improvement is to resolve performance issues and achieve desired outcomes at organizational, process, system, and employee levels. The performance improvement framework is composed of 9 steps that define the performance improvement approach. So performance improvement is achieved through a systematic process that goes through the following steps. So the first step is to analyze the institutional context. Okay, you're analyzing the institutional context. So to improve, you need to understand the driving forces in the environment. Okay, so you need to understand the mission, the goals, strategies, culture, the client, and community perspective. Second step is obtain and maintain stakeholder agreement. So you need to know who your partners and competitors are, who can help you, who will work against you, who can um, who can you convince to help you. So these are all questions you must answer as you plan for improvement. The third step in the 9-step um, performance improvement approach is define desired performance. You need to define the desired performance. So you must be clear about what you want to achieve. If you do not know where you're going, you will never arrive. The fourth step is describe actual performance. Describe actual performance. So you must know how you are performing, meaning now, how you are performing now, to be able to measure the improvement you make. So this is your baseline. Without a baseline, you cannot quantify the change. Step number 5 is describe the performance gap. Describe the performance gap. So this tells you how big your problem is. It is the difference between where you want to be, that is the desired performance, and where you are, that is the actual performance. Okay. Step number 6, root cause analysis. Root cause analysis. So this is where you determine what is really causing your problem. You need to get to the root of the problem so that when you get rid of this root, your problems will be over. Think of a tree as your problem. So you can only kill it if you destroy taproot. Okay, that is your root cause. Okay, so this is where you are asking yourself questions like, why does the performance gap exist? Okay, step number 7, select and design interventions. So this is where you decide how to get rid of your problem. You target the root cause with an appropriate intervention. You must think through the appropriateness of your actions, how these actions will fit together, how they will be implemented, how you will monitor and measure the changes that you expect to happen. That is selecting the interventions. Select and design the intervention. So you ask yourself questions like, what can be done to close the performance gap? Step number 8, that is implement interventions. Implement interventions. So this is the action time. This is where you do something about getting rid of your root cause. So this is where you ask questions like, what solutions match the causes? Okay, so that is step number 8. And the last step, which is step number 9, monitor and evaluate performance. So as you implement, you must monitor all activities to make sure all is going well and that you make timely adjustments if you have to. At agreed points, you evaluate to see if the changes are being achieved and to what extent. Okay, so this is the performance improvement steps. So apart from the performance improvement approach, we also have the 5S approach to managing the working environment. So the 5S is foundational to continuous quality improvement and aims at improving the environment in which work is done. The first S stands for sort. So under this one, you need to get rid of unused stuff from your workstation and reduce clutter. We use the red tag technique for this one, meaning when in doubt, you need to move it out. Okay, then the next S stands for set. So organize everything needed in proper order so that you can find easily and quickly. The third S stands for shine. So maintain your high standards for order and cleanliness, meaning you need to clean and inspect or inspect through cleaning. The fourth S stands for standardize. So you need to make sort, set, and shine your norm in every section of your work, meaning you need to make up the rules, follow, and enforce them. Then the last S stands for sustain. So you need to train and maintain discipline so that your work environment is always neat and orderly. So this is the 5S approach to managing the working environment. The 5S is an approach to organizing and managing the workspace and workflow in order to improve efficiency. It eliminates waste, improves access and retrieval of requisites such as files, and therefore shortens the time required to carry out tasks. It essentially focuses on improving the working environment and is fundamental to all improvement activities. So the benefits that come with the 5S approach is that it reduces workload, improves communication, improves teamwork, increases productivity, creates a clean working environment, improves safety, and increases customer satisfaction. Let us now look at performance assessment and audit. We will start by defining terms used in relation with performance assessment. Performance simply means the action or process of performing a task or function. Assessment, this is the act of making a judgment on something or someone. So to implement performance assessment in any given situation or environment, you need to have knowledge about quality assessment and monitoring and evaluation. Okay, so performance audits. These are independent reviews of government-funded organizations. They assess whether organizations are undertaking their functions efficiently, effectively, and economically. These are often referred to as the three E's. So effectiveness relates to the outcomes or results of a program or activity. A performance audit will compare the planned outcomes with actual outcomes. An example could be where disease rates have fallen as a result of healthcare. Efficiency refers to the best way of doing things, but with regard to acceptable quality. It is concerned with the relationship between goods and services produced and the resources used to produce them. That is, getting the most from available resources. An example could be where waiting times for emergency care at hospitals have reduced over time. The third E is economy. This generally refers to the cheapest way of doing things, but with regard to acceptable quality. It is concerned with minimizing the cost of resources used. An example could be where healthcare supplies or services are purchased at the best possible price. When performance audits are conducted, they may review one or all of the three E's. They can also review a government program or part of a government organization, or review an issue that affects the whole public sector. If necessary, performance audits make recommendations for improvements. Performance audits are important because they seek to improve the accountability and performance of government organizations so that the community receives value for money from government services. Performance audits have three key phases, and these are planning, fieldwork, and reporting. Let us now look at each one of them in detail. Let's start with planning. So during this phase, the performance audit team develops the audit objectives, criteria, and plans the audit fieldwork. Audit criteria are standards of performance against which an organization or program is assessed. Criteria may be based on best practice, international standards, government targets, procedures, or guidelines. The second key phase is fieldwork. So during this phase, the performance audit team will collect information relevant to each audit criterion. This involves interviewing people within the organization, taking surveys, and reviewing documents and data. The third key phase is reporting. At the end of fieldwork, the audit team meets with the organization's management team to discuss the audit's findings. Following this, they prepare a draft performance audit report, which they discuss with the management to check that the facts presented in the report are accurate and that any recommendations are practical and appropriate. A final report is then provided to the head of the organization and to the government. So we have come to the end of this video session on quality assurance.